Hi, all. My name is Kelly Scher. I've been a labor and delivery nurse for almost 6 years. I started my career on a very high risk labor and delivery unit in New York State. I was there at that unit for about a year and 9 months, and then I transferred within the same hospital system to a smaller community based labor and delivery unit located on Long Island, where I've dealt with high risk patients as well as low risk patients during their delivery and stay. Both units I've dealt with providing care to labor patients with certain comorbidities, but regardless of whether these patients are low risk or high risk, the general goal for patients in labor is to progress their labor and dilate their cervix to 10 centimeters. Um, Going hand in hand in order to get them to 10 centimeters, um, I'm constantly tending to their needs and carrying out certain interventions to help them progress their labor and to effectively push and deliver a baby safely. In my career, I've experienced all methods to properly and safely deliver a baby. Especially when inducing a patient or taking care of patients early in labor, there are certain medications, which I just mentioned, that can help progress their labor. Even if you're not entirely familiar with labor and delivery and you work in certain other specialties within the hospital or an outpatient facility, I'm sure all of you have heard of the word Pitocin. It's a very common medication that patients receive during labor to get their contractions more regular, as well as other medications such as Cytotec. Um, these are two of many induction agents that we use for patients in labor to help them progress in a timely manner. However, some patients may be against induction medications. They don't want to go the route of pharmacological interventions, or sometimes patients do receive pharmacological interventions and do need additional help to move their labor along faster. Patients can be in prodromal labor for long periods of time, meaning that they can be in very early labor and be experiencing contraction pain for days on out, but they might necessarily not be dilating as effectively as they should. I have to say that in the beginning of my labor and delivery career, there were not peanut balls readily available on either labor and delivery unit that I worked on. Or I have noticed peanut balls being available on my labor and delivery unit only within the last 2 years or so. The question is, have you ever heard of a peanut ball as a nurse outside of the labor and delivery field? Do you think the general public knows much about peanut balls? Are peanut balls discussed or brought up on mother to be forums, maybe on Facebook or other forum pages where I do find that a lot of laboring patients that I take care of receive a lot of their information? The thing is, most labor and delivery nurses themselves aren't too familiar with peanut balls, so it originally made me think that the general population wouldn't know much about them either. Um, I receive care and take care of patients in labor a lot of the time where they did not receive a labor course, they didn't go to any prenatal coursework. It's their first baby, and it's a very vulnerable time to have a baby, and they may not be properly educated, and they do um, rely solely on their nurse at the bedside with them to give them a lot of information. Patients won't know about the peanut ball if their nurse isn't that comfortable with peanut balls or haven't been properly educated on the benefits of peanut balls. In the beginning of the spring of this year in 2021, I realized it is important to educate the nursing staff on the floor that I work on, the importance of peanut balls, and why it is so beneficial to use them with their patients in labor. I found that peanut balls were present on my unit, but not as many nurses were using them due to the fact they weren't comfortable with them or they were not fully educated properly on how they work. The first 6 months or so, we had different types of peanut balls, meaning that different sizes on our unit, and they were collecting dust, honestly. I don't recall management even really addressing the fact that we had peanut balls there. It was kind of the question of, what is that? Um, Peanut balls are similar to yoga balls, but in the shape of a peanut shell. They come in an array of different sizes, like I mentioned, and the sizes are dependent on the patient's height. You may use one of the smaller size peanut balls for patients that are on the shorter side and vice versa. Peanut balls are great because they are non-pharmacological interventions, and can help patients progress their labor as well as the pharmacological medications. They're ideally used when patients aren't as mobile with perhaps an epidural in place because with epidurals, you're pretty much numb from the waist on down. It takes away contraction pain and you're super numb that you might not even be able to lift your lower extremities. The peanut balls are geared towards helping widen the pelvic outlet in order for the fetus to descend. The benefit of peanut balls is to shorten the amount of time for patients in labor, potentially reducing cesarean section rates, reduce the use of pharmacological interventions, and reduce the rate of interventions for patients in labor, such as forceps or a vacuum during delivery. Patients that have a peanut ball in place are ideally placed in a side-lying position to help place the peanut ball effectively in between their legs. Ideally, these patients, if they have a peanut ball in place, they should be rotating between left and right position every 30 minutes to an hour. Position is key with a peanut ball in order to help widen the pelvis for the progression of labor. I have actually seen that with the use of peanut balls, they can even change the position of babies from occipital posterior, which is when the baby is facing sunny side up but head down, to occipital anterior, which is more ideal because patients that have a baby in the presentation of occipital anterior have an easier pushing progression during their pushing timeline. This information I provided in regards to the benefits of peanut balls was shared amongst nursing staff that attended one educational session on the benefits of peanut balls with pregnant patients in labor. With identifying the need for education on peanut balls amongst staff, I carried out 3 30-minute educational sessions amongst staff that wanted to attend to learn more about the topic and how it can benefit them within their own practice. It was non-mandatory, and the nurses that wanted to have the opportunity to learn more about the benefits of peanut balls, I had asked them to fill out a 5-question pre-test questionnaire prior to attending the educational session, just so I can gauge what I was walking into for those educational sessions with them to see what needed to be addressed and what they truly knew about the non-pharmacological intervention in general. Nurses who attended the educational session had 1 week to return the pre-test to evaluate their knowledge. After attending the one educational session, post-tests were handed out 1 month after attendance to evaluate their knowledge retention. It might be all great if they do attend one educational class and walk out of there, but it's really what's going to be the to see the true outcomes and results was to see what they took from that course 1 month afterwards to see if they really retained that knowledge and to see if that knowledge was retained and if they were using it in their own practice. After comparing the pre-test and the post-test results from each nurse who attended the educational sessions, overall it showed that there were higher post-test results than pre-test results. Due to the fact that the post-test results were higher, I felt that staff will be more encouraged to use peanut balls as a non-pharmacological intervention after attending the educational session. I did address in previous courses that to see those outcomes would be a whole other project in itself, but I was happy to see that the reflection of attending an educational session, again, that was non-mandatory, was beneficial for these nurses, and to see that they retained this knowledge, that they were more knowledgeable about this topic and the benefits of peanut balls with patients in labor after attending the educational session. Seeing the pre-test results and the post-test results were a clear reflection in itself, and I was very excited to see that. Thank you for listening, and take care.